Hi everyone. Yeah, you're all welcome. The real, the real Lua, Ajoke, Omishakin, Afeni Folashade, Akinyemi Alpha now. How are you? TG Omotolani, you are welcome. You're all welcome. Um, it's nice to have everyone here. Trying to see if I can. Good evening, you are welcome. Vivi Floxy, you are welcome. It's nice to have everyone here. Daniel, you are welcome. Onyi Jennifer, nice to have you here. You are all welcome. Let's just allow other people to join before we start. How is everyone? Zara, you are welcome. It's nice to have everyone here. Miss Selassie, nice to have you here. How are you? You are welcome. I'm trying to see if I can write the topic. Why men find it difficult to impregnate their partners. I'm trying to pin this. How do you pin the topic? I've sent the topic online. How do you pin it? I'm trying to see how I can pin it. So why men find it difficult to impregnate their wife or their partners, whichever one we may call it. So that's the topic. Can someone help me to write it and pin it? Because I can't really do that. It's Abby, you are welcome. Abimbola, you are welcome. Hehi, you are welcome. Amazazi, you are all welcome. So I can put this one here. Okay, I think I've pinned it. Yeah, I've pinned it. All right. What's the time now? All right. Okay, so I think we can start. I think we can start. Um, can you all hear me? Let me know if you can hear me. Can you reply, please? Wumi 500, how are you? Can you reply so that I can know if you are hearing me? Am I loud and clear enough? Can you hear me? Yes, all right. All right. All right. Okay. All right. Thank you. Thank you. So, um, it's nice to have everyone here. It's been a while. but I feel there is a need for me to have another live program because and I decided to make it based on men because I've been seeing a lot of men come down with male factor infertility. I've been seeing men with sperm problems. In fact, over the last 2 months, the rate has actually increased. So that's why I feel it's nice to talk about it. Love it. You're welcome. That's why I feel it's nice to talk about this issue, and so that men can also know that the problem can be from them. It's not only the problem of the woman, because I found out that a lot in most instances is the women that you will see in clinic. Women are those ones that will come to fertility clinics. Women are those that you will see in churches praying, and a lot of times especially in our culture, is women that people will be asking, why have you not given this man a child? The mother-in-law will be asking the question, why have you not given my son a child? And nobody has really sat down to look at, what if the problem is from the son, or what if the problem is from the man? And I've seen few instances in which um, a lot of families just went like that, just divorced and all those things, thinking that the problem is from the woman. There have been a lot of disputes in the family that has led to this. I mean, that is from this problem. Infertility has been a major issue. Sorry, I have not introduced myself. I should have introduced myself from the beginning. I'm Dr. Sheyi. So I'm a fertility and conception expert. I'm a consultant gynecologist too. And I've been practicing in this field for more than 10 years. And I decided to open an online platform because of the experiences I've had over time. I found that there are a lot of problems with couples, as per getting pregnant, maintaining pregnancy, and delivering a live baby, has majorly been due to lack of knowledge. There are a lot of people that are having problems with knowledge. A lot of pregnant women are dying from pregnancy or from delivery because they lack the knowledge. A lot of couples are having issues with getting pregnant because they lack the knowledge. So I decided to start an online platform, Ask Dr. Sheye on Instagram, Ask_Dr. Sheye on Facebook, to be able to give knowledge and to be able to help people understand why they need to know what the problem is and the things they need to do for this issue to be sorted out. Thank you, Perez. All right, so like I was saying before, um, men have actually been a major cause of infertility in the family. It's not only the major problem of women. A lot of times you would think it's the woman that has the problem, and that is not the truth. A lot of people I mean, a lot of reasons are actually due to the men. And when you look at the percentage of infertility in men and women, they contribute to the same percent. 30% are, I mean, cause of infertility among couples is from the man, 30% from the woman, and 30% from both of them. While 10% is majorly due to an unknown reason, an unexplained reason. So that's why I decided to talk about men today. And because there is a need for men to have this idea and have this understanding that it can be the major problem. So what is infertility? I always start by defining what infertility is. Before a couple can say that they are having problem with conception, or they're having problem with being able to get pregnant, they must have had regular sexual intercourse for a period of a year. if the woman is less than 35 years, or for a period of 6 months if the woman is 35 years and above. Adequate sexual intercourse means that at least 3 times per week. That means if you have on Monday, you have on Wednesday, you have on Friday, and there just leave a day in between. This is because the sperm can last for about 72 hours, 3 days max, and the egg only lasts for 24 hours. So if you just have sex once a week, let's say you have sex on Monday and the woman releases egg on Friday, and the next time you're having sex again is on Tuesday the following month, the following week, that means the likelihood that that woman will get pregnant is very, very reduced, because the sperms will have died before the egg dies. The egg can only last for 24 hours. So that is why it is very important. Before a couple can say they're having problems with conception, before they can say they're having problems of infertility, that means they must have had regular sexual intercourse for a period of a year, 3 times per week, or 6 months if the woman is more 35 years and above. So when will you say a man is finding difficult to get a woman pregnant? That means that if the man has been having a regular sexual intercourse with the woman for a period of 6 months, if the woman is more than 35 years and above, or a period of 1 year, and they have not been able to get pregnant, and the problem is from the man, that means that the woman has been sorted out, the woman has been shown not to have any problem. So that is when you can say a man is finding difficult to get a woman pregnant. And it's really getting common these days. You find out that men are just coming down. I've had cases in which the man doesn't even have any sperm in the semen. There is no sperm cells in the semen. There are some that are not even ejaculating semen. And it's something that is becoming more of a concern that we need to start talking about, or talk about more. It's not that we have not been talking about it before, but there is a need to talk about it more, so that it will once men start knowing that it can be the problem, then they can also try and seek help as soon as possible, because if you don't seek help, you are just wasting time. So it is very pertinent that we understand this. So what are the causes, what are the reasons by which a man may find it difficult to impregnate his partner or his wife? I usually broadly classify into two. It could be problem with production of sperms. The sperm is produced in the testis. Testis is inside the scrotum, and at least we know where the scrotum scrotum is, or the scrotums are. And inside the scrotum is just like a bag that contains the testis. So if you touch the scrotum, you feel something that looks like egg, that feels like egg, that you can touch. That is the testis, and that is where sperm is being produced. So it could be problem with sperm production, or it could be problem with sperm transportation. During sexual intercourse, sperm is transported from during orgasm, when a man reach orgasm, and ejaculates. That ejaculation is due to transportation of sperm from testis, where the sperm is being produced, that is deposited into the vagina. So anything that can affect those two processes, anything that can affect production of sperm or transportation of sperm, will lead to problem with, will make it difficult for a man to impregnate a woman, or for a man to get a woman pregnant. So what are those things that can affect those two processes? One of them, are you following me? Let me know if you are following me, so that I won't just be talking. Just someone should tell me if you are following me. Are you getting me thus far? Just let me know. Just say yes. Somebody should just type yes, so that I will know that I'm being followed, or you are following me. Just type yes. I'm waiting for a yes. All right. Thank you, Purified. All right. So if you are not hearing, thank you, Mercy. Okay, thank you. All right. So now, All right. Thank you, sexy pill. Thank you. All right. So, what are those things that can affect a man, that can make the man, that can make it difficult for that man to impregnate a woman? Um, Age is one of them. Though not like you, not as pronounced as it is in women, but it's been found out that from 40 years and above, um, there is reduction in the concentration of sperm. That means in the amount of sperm that is produced, and in the normal production. I mean, the normal sperms. As in, as you grow older, the normal sperms start reducing. The amount of sperms that you are producing start reducing. The amount of sperms that can move very well start reducing. Though you still see men as old as 70 years impregnating women, but as men grow older, the sperm parameters decreases. So as age affects women, it affects men, though not as pronounced in men. Other problems can be alcohol intake, smoking, use of drugs. People that are taking alcohol, especially the heavy drinkers, they have alcohol has chemicals that affect sperm production. Cigarettes contains nicotine. Nicotine affects sperm production. Not only smoking directly, when you also stay around smokers, you are a secondary smoker. So that's why I tell a lot of men, they will tell me that they don't smoke, but they are always around friends that smokes. And when you have friend that smokes and you are staying around and you're having problem with sperm, with your sperm parameters, then you should watch it, because that could be the reason why the sperm is having problem in the first instance. So not only being a direct smoker, but an indirect smoker is also an issue. Then eat. I always tell men that there is a reason why God placed the testes in the scrotum and outside the body. Majorly because production of sperm has to do with temperature regulation. That to be, there is an amount of temperature, there is a level of temperature that is needed for sperm to be produced. Now, if that temperature is affected, if maybe the temperature is too much or too low, most of the time it's actually when it is high that affects or damages the sperms. So when you notice during heat period, the scrotum is away from the body. The scrotum dangles more away from the body, and during cold period, you find out that the scrotum comes closer to the body. In such instances, that is showing you that the temperature is very, very important. When the body is hot, when the temperature of the body is high, the scrotum goes away from the body, the testis goes away from the body, and so that the temperature will not kill the sperms. So when you are doing things, when you are doing things that can increase the temperature, using hot water to bath as a man regularly, it can affect the temperature of the sperm. Wearing nylon pants can affect the temperature of the sperm. Um, Wearing tight fitted jeans, tight fitted pants can affect, because it will increase the temperature. Among men that are fat, obese men, because when you are obese, fat will cover, you will see men that are obese that their tummy is, there is flap of their tummy over their scrotum, such that there are fat pads around. Fat generates heat. So when a man is big to an extent, it affects the temperature. It affects the temperature and affects the production of sperms around the testes. So fat men affect, um, I mean, temperature in fat men affects sperm production. So these are some of the problems. There is something we call retrograde ejaculation. Instead of when a man ejaculates, the sperm is supposed to go directly into the from the testis. It goes through the pipe and is deposited into the vagina. While in retrograde ejaculation, instead of it getting out into the vagina, it goes into the bladder. Bladder is where urine is stored, and when it's going into the where urine is stored, that means that there is no way that person, so you just find out the man is not even releasing anything. The man is not, when you have sex, the man will show that he has ejaculated, but you are not seeing anything, or you're just seeing something that is very small. So in that instance, it could be that the man has retrograde ejaculation. So there's something we call varicose vein too. Varicose vein means that there are veins carries blood, they carry blood around. So there are veins around the testes. Now these veins, they can become engorged and enlarged such that they are bigger than they are expected, and that means they will retain more blood than expected. Blood moves around the body, so and blood takes temperature around the body, so such that if blood pools around the testes, that means the temperature also increases, and when temperature increases, it affects the optimal production of sperm production, optimal production of sperm. So these are little things, those things that we may overlook, can be the reason why a man is having problem with conception. Then weight, like I've talked about weight, when the man is fat, it affects infections. A lot of people have sexually transmitted infection and they don't take it, they don't treat themselves well. When you have sexually transmitted infection as a man, it can damage the testes, it can damage the pipe. There are pipes that carries sperm from the testes and deposit outside the vagina. When these infections are not treated, chlamydia infection, gonorrhea infections, when they are not treated right, they can damage those pipes and block them. So when they are blocked, that means there is no way the sperm will come out from where it's being produced and will get outside. And in such instance, that means that the man will find it difficult to be able to impregnate the wife. There are other medical conditions that can also affect a man being able to impregnate a man. The man being able to impregnate a woman, sorry. Diabetes mellitus, hypertension. One of the problems with all these medical conditions are some of their drugs. There are some drugs that can affect sperm production, or that it can even cause retrograde ejaculation, like I explained before. So in such instances, that is why those conditions can affect. Then some of these conditions can even affect erectile function. Just find that the man is having erectile dysfunction. He's not able to stay erect for a long period because of these medical problems. So these other, like I talked about, the sexually transmitted infection, diabetes mellitus, all these things can affect. There's something we call testicular torsion. It affects more of younger men. There are a lot of men that they had the problem while they were younger. You just find out that they are not producing any sperm again. We call it azoospermia. That you go and do a sperm test and you can't see a single sperm. Some of the problems actually happened earlier. When you notice that, and this is for those people that when you become a parent, or when you as a parent, you should notice more. You should check your male children better. So one, when you notice that the scrotum becomes swollen and it's painful, such instance, it could be an infection that is causing that swelling. Sorry, it could be the infection that is causing the scrotum to become swollen, or it could be what do you call it? It could be testicular torsion. What testicular torsion means is that when you look at the testes, there are, like I talked about this, the pipe. There are pipe connecting the testes to the penis. Then there are vessels that carries blood. The veins I talked about, they are arteries. Now they are in form of a stalk. When you see a fruit has stalk that joins to the tree. Now when this stalk twists, it blocks blood supply to the testes. And one thing the testes need is blood supply, because from the blood there is oxygen. From the blood there are nutrients that will nourish the testes. So once these are blocked, that means that the testes will be deprived of everything it needs to survive. So it responds by getting swollen. It just swells up. And if care is not taken, you just go to a chemist, because that is the major problem that a lot of people That's the major problem that happened during that time. They just take them to a chemist. What will chemists do? Chemists will give you antibiotics because it feels that okay, maybe it's an infection. Well, it could be an infection can make the testes to swell up. They will give you pain relief. So when they give you pain relieving drugs like paracetamol or ibuprofen and all those things, you won't feel the pain again. But the problem has not been sorted out. And by the time if the thing does not untwist itself, that testis dies. And once the testis dies, that is the end of that testis. That testis can never produce sperm ever again in life. And if it affects the fact that it affects the first one, it will likely affect the second one. That is why you shouldn't take such thing, with levity. It is very, very important. So testicular torsion, like I discussed, is a major problem that you should also look at. Erectile dysfunction, I've talked about erectile dysfunction. Loss of libido, I've talked about that. So now, how do you determine if you have problem? You have sperm issue, or you're having difficulty with impregnating your wife. Major way is to go and do a sperm test. I've had men doing sperm tests now. In those days, men don't believe that they are the problem. They just say it's the wife, it's the woman that has issues. Or you say I've impregnated many girlfriends in the past. The fact that you have impregnated many girlfriends in the past, or that you even have a child from another marriage or from another woman, doesn't mean that you cannot have problem. One, the age at the time you impregnated those girlfriends is not the same age you are now. You could have had sexually transmitted infections over that period of time that you didn't treat well. You could have gained weight. You could have had medical problems that could be causing problems. So you can be on drugs. All these things, they sum up together to affect fertility in men. And that is why it is important that you don't just say because you have impregnated someone, or because you have had a child or children with a woman, that you cannot have problem again. It is a lie. It doesn't mean that you cannot have problem again. So I don't want men to always have that idea that because you have a child and you don't have the problem. It's a lie. So you need to do a sperm test. And what is the sperm test meant to do? It's meant to check your sperm, to look at the volume. When you have sex and you ejaculate, we call that semen. Semen contains water, it contains sperm. And that's what is the water part that comes out from the vagina after sexual intercourse. And that's why women talk about sperm leakage. I say, okay, because sperm is leaking, they have problem. It's the water part of the semen that comes out from the vagina, and that is one that okay, I will. You can, when I'm answering questions, I will give you my number. Don't worry. All right. So where was I? Yeah. So semen contains sperm and contains water, and also contains other things. So the sperm is very important when you are doing seminal fluid analysis. So you go to a good laboratory and you tell them you want to do a seminal fluid analysis. Excuse me. Now the seminal fluid analysis, before you do a seminal fluid analysis, you must have abstained from sex for about 3 to 5 days. You must not have sex for about 3 to 5 days, because if you have sex before going for the test, it will reduce the quantity of your sperm may reduce, and it may make us think that you have sperm problem. So that's why it's very important for you to abstain from sex at least 3 days before you go for the test. So what the semen analysis is all about is they will ask you to bring your sperm or your semen. So from the semen, we look at the volume. The volume must not be less than 2 mils. They will write it when you see the result yourself. You will see the result. The volume is 2 mils. Then when they will look at the sperm count. The sperm count must not be less than 15 million. That means it must be 15 million and above. So if you have anything less than 15 million, that means you have problem with sperm count. and that can affect being able to impregnate a woman. Then the motility. Motility means that when you deposit sperm in the vagina, sperm starts moving forward. It starts moving forward, it enters into the cervix and enters into the womb, and from there gets to the tube where it meets the egg. Now, anything that affects this motility means that the sperm, there are some sperm that they will just be dancing on the spot. That kind of sperm is bad, has a poor motility. There are some sperm that are not even moving. There are some that they are just cycling, just moving in a circle. So such sperm are not moving, but those that are move forward are the ones that are important. When they are moving forward, are they moving fast or they are moving slowly? These are important things that you need to look at when you look at a seminal fluid result, a seminal fluid analysis result. These are the things they will write there. They will look at the sperm motility. The sperm motility must not be less than 40%. So if you see anything less than 40% in your sperm, in the sperm that the test, the results, that means there may be problems somewhere. Or you are seeing that the forward moving sperm, they are lower than 50% of the 40%. Because when they look at the motility, they will look at the sluggish moving sperm, they will look at the fast moving sperm, they will look at all those and the sperm that are not moving. So the percentages of those sperms will also determine if your sperms if they are fine or not. Then there is something we call morphology. Morphology means the shape. There are some sperms that have, normally a sperm is supposed to have a head, a neck, and tail. But there are some sperms that have two heads. There are some sperms that have two necks, or there are some sperms that don't even have tails. So these are abnormal sperms. So if you have at least 4% of your sperms normal, that's the least. Some people say 14%, but the least is 4% must be normal. So that means if you don't have normal shaped sperm of at least 4%, that means that sperm has problem. These are important things you need to look when you are doing a sperm test. Then you also need to look at the viability. Viability means the amount of sperms that are alive. A lot of people, you see 200 million sperms, or you see 100 million sperms, or you see 50 million sperms, but you see that dead sperms are more than 90%, or dead sperm more than 70%. That means that majority of the sperm are dead. They are just many. So the person has many dead sperms. And when you have dead, it's just like you have army, but they are dead. More than 70% of them are dead. That means you are defenseless. That shows that excuse me. That shows that majority of your sperms, they are actually many, but majority of them are dead. That means you cannot be able to get a woman pregnant. So these are things when you go for a sperm test and you see these parameters that are not normal, then you should start looking at what are those things that you are doing that are affecting your sperm. What are those things that you need to do to improve your sperm? If all the causes that I've listed, if you are drinking alcohol, you are smoking cigarettes, you have you are wearing tight pants, or you are doing things that men, a lot of them will put laptops on their palm, you put phones in your pocket. All these things, one way or the other, affect sperm parameters. So you need to look at all these things. What are you doing? Is your weight increasing? Are you using any drugs presently that can affect the sperm parameters? So these are the things you should look at if you do a sperm test and you are finding it that there is problem. So you should look at it and you should see a specialist. It's very, very important, so that, because there are other things we will look at if you're having this kind of problem. There are other things we'll look at and say, okay, this is what we should do, and then see how we can help out. So when should you be concerned as a man? When should you be concerned? So let's say that whenever you ejaculate, your ejaculate or your semen is bloody or blood stained, that means there is a problem somewhere. Anytime you ejaculate and it's blood stained, is red or pink, is not the normal cloudy color or milkish color. when you ejaculate, that means something is wrong somewhere. You should look at, okay, what is causing it. If you are not ejaculating at all, or you are ejaculating little per time, then you should be worried. Even if you are not yet married, you should be worried. You should find out, okay, what is the problem? Why am I having this problem? If you are discharging pus from the penis, from the head, some people they discharging pus, or when you pee and it's peppering you or it's paining you, you should be worried as a man, because it means that you may likely have infection. And if the infection is not well treated, that means it can damage your testes, or it can block your tubes that carries the sperm. It may affect your ejaculate. So these are important things that you should. Then if you have a scrotal swelling, you should be worried. If your scrotum swells up, you should be worried. And if you touch your scrotum and it is very small, if it is small, there are some, when you touch some people's scrotum, it looks like a child's scrotum. So that means that there is problem. That means you need to get yourself checked. You need to look at, why am I having this problem? These are important things that men need to take cognizance of. And it will help if men can start looking at all these things and start taking cognizance of all these things. It will help a long way to reduce infertility in couples. So what should you do to improve your sperm production? What are those things you need to do? I will soon round up so that you can ask your question, then we can, from there, answer questions, then we'll call it a day. All right, so what should you do as a man to improve your sperm production? Lifestyle modification is the first. If you are smoking, you need to stop smoking. If you are always around smokers, I told you that it's not only being the direct smoker, but an indirect smoker. A secondary smoker also is smoking indirectly, and it's going to affect your sperm production. So you should stop smoking. You should stop drinking alcohol. If you are on hard drugs, you should stop taking those drugs. If you are on steroids, some people are using steroids. Except it's medical, it has a medical indication which you must discuss with your doctor. You should stop them. Some people are trying to build muscles. They are trying to increase their muscle mass, and they are taking steroids and all sorts of things. You should stop, because some of these things are not good for you. Some of these things are not going to allow your sperm parameters to improve. Then then you should exercise as a man. You should lose weight. You should eat healthy. One of the problem we have in our environment is westernization of our food. A lot of people are eating junks. They are eating things that are not healthy. So you need to eat healthy food, healthy meal. Take vegetables, fruits, all these things that will improve and that we can categorize as healthy meals. Sugars must reduce. A lot of people take cake a lot. You take a lot of sugary things. It has to reduce if you are trying to conceive, especially if you have been able to find out that you have sperm problems. So you should stop all those things. You should exercise. There are some form of exercises that you should not also do. Cycling, for instance, because when you are cycling, your thighs come together, and when your thighs come together, generate heat. It can affect your testes more. It can affect the sperm production more, because when the heat is being generated, it can affect it. So cycling may not be good for you if you are having sperm problem. So maybe moderate jogging. There are some other exercises that you can do that can help with improving, because when you exercise, you jog, you do some other cardio exercises, it will improve blood supply to your body. It reduces depression. It makes you happy too. All these things are important things. Then you take supplements. Supplement helps a lot in improving sperm parameters. Vitamin C improves motility. Vitamin D improves sperm production, improves motility, improves morphology. Folic acid is very good in improving, because folic acid is important in cell production. So in producing normal sperms, folic acid is good. So you take vitamin C, vitamin D, folic acid. These are good Vitamin C is also an antioxidant. It clears oxidative stress. Oxidative stress can affect sperm. They can cause what we call DNA fragmentation of the sperm. These are the things that makes a sperm abnormal because the DNA in the sperm has been affected. So these are what we call sperm boosters. There are other drugs that are actually particular to helping sperm improve, but most of these things are the things that you need to. Then you sleep well. A lot of people don't sleep well because sleep is also important. Sleep is important for the normal functioning of the body. At least if you can sleep at 6 to 7 hours a day, it also will help you. It will help your body to replenish itself and get better. So if you have any question, I don't know if people have put any question up. If you have any question, you can start asking before we call it a day. I hope you have been able to follow me. Can I get reply from people? I hope you have been able to understand what I've discussed so far. Let me see if I can see any question here. I can't find any. If you have any question, you can ask. MZ Ruby, you are welcome. How are you? If you have questions, please ask. So, does dead sperm affect womb? No, dead sperm does not affect womb. Dead sperm is just dead. Dead sperm will not even enter the womb. Because in the vagina, when you deposit sperm in the vagina, the sperm starts moving. They will move through the cervix, which is the entrance to the womb, and then they start moving up. That is why when people talk about that they have sperm leakage, I don't really care, especially because most of the time the sperm cells are expected to move up. So dead sperm will not even get to the womb, so it can't affect the womb. What drugs can one take to rectify the sperm? I've talked about drugs to take that drugs that are supplement that can improve sperm production. I've talked about folic acid, I've talked about vitamin D, I've talked about vitamin C, and there is what we call coenzyme Q. These are also drugs that you can use that can help to improve sperm production. But if there is problem with sperm production, there are other things we need to also look at. It takes 3 months for a sperm to be produced. So if you take all those supplements, you can repeat the sperm test in 3 months to see if it has improved. If it has not improved, then you need to see a specialist. In fact, you need to see a specialist once you do a sperm test and there are bad or abnormal parameters. You need to see a specialist because there are other things we may need to look at. Like if you come to me, for instance, and I see the result, there are some questions I will ask you. There are some other things I will ask you to go and do, especially if I feel that there are other things that can be the problem. To look at what is causing them, from that we sort it out. So, but folic acid and all those drugs, they can. What drug can one use for PCOS? We are actually not talking of PCOS, but PCOS. Maybe I will find time to come and discuss PCOS. PCOS is another entire. It's a different topic on its own. So today is not for PCOS. And I think if you go to my YouTube page, I think I've talked about PCOS in my YouTube. You can check my YouTube page. Ask Dr. Shea. Just check my YouTube page. You can I discuss something about PCOS there. So you can look at it. Any other question? So if you need to have a one-on-one consultation with me, it is not free. You can send a DM to me on Instagram, or you can send a WhatsApp message on 080 66 27 5937. 08066275937. If you want a physical consultation and you are in Lagos, we can also work out consultation. Yeah, Vitamin B is also very good for sperm. Vitex also fine, but vitamins especially, they are vitamins generally they are good for sperm production. So, but most other just take supplements generally, not only vitamins B6. You take when you can there are drugs that contains all these supplements. They contain folic acid, contains vitamin C, contains vitamin D, contains vitamin B complex, and all those other things. Zinc, yeah, zinc is also very good for sperm production. Then you if you have problem with sperm motility, you can eat nuts, groundnuts, cashew nuts, walnuts. They have been found to improve sperm motility. So these all these things can be they can be part of drugs that you can that can be part of food or fruits that you can incorporate into your diet. What drugs are recommended for sperm? I've spoken about these things over and over and over again. I've told you vitamins, zinc, coenzyme Q. um, these drugs you can use them. There are other specific drugs that maybe when you come for consultation and we look at what the problems are, then we can now determine, okay, if you need those drugs or not. But those are the general drugs that you need. Those are the ones I've talked about: folic acid, Bico, zinc, vitamin D. Which other one? I think those are the major ones. Vitamin C improves motility. I've said this over and over and over again. Any more questions before we call it a day? I hope this session has been a wonderful one. I hope you gained a lot, and I hope it is going to help. So can I get a feedback? Has it been a wonderful one? Let me know. Have you gained enough from it? I'm waiting before we call it a day. And if you still have a question, if you still have question, you can ask. Also add O6. I hope I've answered your question. Sexy Pearl collection. Top crowds. My address. Don't worry. When you send the message to me, I will tell you how you can get to me. But that's I've let me write my number here again so that you can 08066275937. 66275937. All right, so that's my number. You can send a DM to me to book for a consultation. There are two options. We have online consultation and there is physical consultation. So we'll tell you how you can go about booking and the consultation fee for each of the option. So should we call it? Thank you, Prince Chat. Thank you so much. Thank you, everyone. I'll find out to go and talk about polycystic ovarian syndrome again, or talk about anovulation generally, because that's one of the other problems that women are having. Women are not ovulating. I think I've talked about tubal blockage. I've talked about tubal blockage before. You can go to my YouTube page, ask Dr. Shei, tubal blockage. The video is there. You will see the video there. So if you have any problem with tubal blockage, you should check it out. So till another time, it's nice coming here again. So till another time, I wish you all good night. Bye bye. Bye.